Good day to you. Today our topic is somewhat of a medical topic, the non-pharmacological management of a blood pressure that is going to go up, trying to go up. So this is not about patients who are already on medical treatment, but you have found that sometimes your blood pressure, when you check it, it's sort of borderline and you're worried about it. So I want to give you some suggestions what is making your blood pressure lay-by, go up and down. So this is not about those who are on medical treatment, but who are finding that they have, you feel like that you have pressure. So you must go to a doctor and get advice. But this is about the simple things that are causing you to have ups and downs in your blood pressure. So observe these things even when you are treatment. This will be helpful. Firstly, work with your dopamine of your brain just enough for direction. So in your executive empathic tracts through the prefrontal cortex, dopamine works. Every hour there's a default mode network of thought. So dopamine works for 45 minutes and comes down. It must be allowed to come down. But if you're all the time pressed and troubled and hurried, dopamine doesn't come down and it begins to affect your adrenocortical systems, your pressure control systems. So first thing I want to tell you is work with dopamine just enough for direction, focus and salience. If you trigger your dopamine to insistent mode and from physiological DA1 to addictive DA2, you will hurry, demand, command, hurry, flurry till dopamine rises. Change your lifestyle, change your orientation to life. 2. Allow serotonin to get you reward. So when you do something, allow that sense of satisfaction to come in without all the trying, finding out what went wrong, who went wrong, perfectionist, I want everything done to my way. So that will put up your blood pressure and your dopamine unnecessarily. Then keep your oxytocin bond homey, keep time to talk to people, keep time to talk nicely to people. Then keep your GABA empathy, a little compassionate, don't be dyspathy, because when you go bottom down regulation, stimulated by everything and reacting to everything, that's called dyspathy. Then GABA is not working, gamma aminobutyric acid. So keep your relationships, conversations, tone of voice, smiling face, that's right, smiling face. Thirdly, practice default mode network of thought and character. That is, every hour be conscious. Now 45 minutes gone, next 45 minutes I will take it easy, check back, how to improve. Automatically your brain will do this unless you are digitized or demanding. So young people get to digitization, older people get cranky with everything that they want to be done, must be done immediately. Get off that trip so that you can live easier, yes, and make life easier for those who are around you also, yes. Fourthly, make every meal time happy, quiet, seated, intentional, munch and crunchy. Take time over your meal. It's therapeutic. It brings your adrenal cortical system to normal, blood pressure to normal, and that munching, crunching activity and that pleasantness of oxytocin helps regularize your blood pressure also. So don't be rushing and serve standing and rush off. No. Consider mealtime as socially important, emotionally important, medically important to keep your blood pressure and other neurochemical transmitters in good order. Make mealtime therapy time with neurochemical balance restore. Fifthly, live in empathic executive top-down regulation. Think and do, initiate, navigate, conclude one thing at a time. Don't get into multitasking, doing this, running there, here and there. Your 45 minutes, try to be in one place if possible. Of course, if you have to drive, someone may drive, you may drive, that's okay. But your general 45 minutes, try to be one place if possible. And don't be multitasking, even on too many digital platforms. So live in empathic executive, happy mode, then with serotonin doing its work, rather than be amygdala driven, bottom up, reflexive, reactive reacting to everything, comment for everything, and that's not right, he's not right. Yeah, don't get into that. That'll increase your blood pressure. Sixthly, how many people's life do you think you have to drive? So don't get into driven mode and drive mode. You think you have to check this, check that. You can't delegate. Even if you delegate, you have to check up everything. Don't get into that mode, because your blood pressure will get upset. Seventhly, on how many things are you first on call? All these drive dopamine and the adrenocortical drive, which increases blood pressure. So don't be first on call for too many things. Be first on call for what you have to be, for your spouse, for your children, and in work realm, the essential things. There are people who have to be first on call for everything. They have to be consulted, they have to give an opinion, blah, 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 blah. And keep your, the next thing I want to tell you is, point number 8, keep your morning as long as possible cool. So you have to go to work, of course, and even on a weekend when you're at home, don't get into work mode, and by 8 o'clock you're all hurry flurry and red in the face and your blood pressure is ticking. No. Keep your morning as long as possible cool, unaffected, and what shall I say, empathic. Yes, as long as possible. Then point number 9, give up remonstration. Remonstration is when something goes wrong, someone is wrong, you are repeating it, reacting to it, telling it to others, telling that person again, you recall it. That's what remonstration is. Your cause may be right, but your response is wrong. Take time, digest, let it sit down, let it cool off, and the one whom you want to improve, get into your head, it's not correction but improvement. Then once the issue is a little colder, they also may listen to you better rather than defending themselves. 10thly, give up recrimination. Sometimes you recrimination about yourself and how you didn't do it well enough, or your child or spouse. Always your comments are about what is not right, what is not short. So keep this ratio 4:1. 4 good comments, nice comments, commendations. 1, the thing that you want improved, choose it. And every hour, don't do the correction things. Every other hour, do the nice things, and choose a nice quiet hour when things are easier to do what you have to say as correction or improvement. So balance the ratio of appreciation. Other it will be just depreciation, commands, demands. Don't get into that mode. So 11th one, stop your acrimonious comments on issues you can't solve. Maybe politics, economy, what goes on the television. Just reduce your viewing time of all kinds of programs, and your blood pressure goes up and down with it. Your serotonin gets upset, and then keep good sleep habits. This would be the 12th one. Keep good sleep habits with after 6 p.m. allowing your melatonin to get into action and work through. And 13th one, of course, is that any amount of too much of screen time always add to stress time, even for necessary work. Then if you're on digital games or unnecessary clips and all kinds of screen time, multitasking, many platforms, you have to keep your melatonin after 6 p.m. for sleep, and reduce the screen time, because the screen pixels work to get you dopaminergic and shift your dopamine DA1 physiological to DA2. So overuse of screen, telephone calls and hanging on it, and commanding, demanding, so what you can do face to face, don't all the time go on the phone and media. Lastly, 14th one, of course we all know exercise and right food habits, of course, help. My suggestion is morning an egg and fruit bowl helps to get your neurochemical things also into order, besides the health. Now I have not touched on everyone knows about dietetic habits that improve the blood pressure control. That was not my talk. It was about getting your mood and disposition right, so that you don't give nasty jerks to your blood pressure. I'm Dr. Lalith Mendis. I hope it helped you. I was founding head of pharmacology in a state medical faculty. I am at present director Colombo Empathic Learning Center. I have done many clips on kids and their risk disposition. If you want any of those things, you can contact my secretary for a consultation. It's free of cost. 077-151-2801. If you want to send me a post for a request, ask for more clips of this nature, science, reasons and spirituality, please send a WhatsApp to 074-211-5011. If you are overseas, it will be obviously plus 94-74-211-5011. I am Dr. Lalith Mendis. Thank you for listening. We'll meet again in a broadcast.